I think it's always difficult. You're going to have a big impact on this patient's life. Their life will change forever the moment they walk out that door. So whilst breaking bad news, I'm trying to comfort them immediately that we have a way out. And I think like any bad news in life, if you know there's a way out, you will cope better. I tend to break the news down very, very delicately in small bites. You develop this sense of really understanding the patient, their background, their level of general knowledge, their age, and take all of this into account as you break the news. The approach to every patient with cancer is really tailor-made for that patient. Although I would generally give an outline of the treatment process, I tend to then focus on the immediate next step. At this stage, often the patient is overwhelmed with shock and grief. You just need to be very simplistic in your approach, and this piecemeal, bite-sized bit of information works better. I try to find analogies where patients can relate to. I've used many different types of analogies. Often I'll come down to the engine of a car, for example, and they can understand the air supply or the fuel supply, and you can tell them what's wrong and what needs to be changed. But I've found more recently the analogy of infection corroborates very well with that of cancer. These analogies can help enormously in getting patients perhaps to deal with something more complex and get their mind around it so they can cope better. There's no doubt that the introduction of the C-Care Cancer Center has raised the level of cancer care, which can now be said to be on par with any world-class level of cancer care, both in terms of diagnosis and treatment. It's a significant milestone for cancer care in Mauritius,